Hi, welcome back to the Dr. K Kall. Today we're going to talk about outpatient surgery. As we are starting to gradually gear back into doing surgery with this COVID 19 and getting back to doing some elective cases, I think what we're going to find is that outpatient surgery is going to be the first that are going to get done. So, what used to be my outpatient surgeries for joint replacement was about 40%, and I think that after this COVID 19, it's going to move up to 70 or 80%. Realize that I've been doing partial knees for the last 8 years. I've been doing total knees, total hips for the last 4 to 5 years as outpatients. I've been doing total shoulders as outpatients. So, all these joint replacements can be done as outpatients, and we've been doing them as outpatients. Realize that technology has advanced, both electronic technology, some of the pain pathway technology, some of the medications that we are able to use, the therapy has all changed and made it so that we can do this as an outpatient. All these can be done at our ambulatory surgery center or they can be done at the hospital in the outpatient setting. What we're trying to prevent is further exposure to sick people. Realize that when you come in for a total joint, you're not sick. You came in simply because you have a bad wheel. And we're going to either change a tire or give you a new wheel. And you're not sick, so you shouldn't really have to be in a hospital. You should be able to do this as an outpatient. If you are sick and you have comorbidities, then some people do need to be in a hospital. And in those cases, we need to be very, very cautious and we still need to have you as healthy as possible. The advantage of outpatient is it's less expensive. You're able to recover at home. There's less exposure to infections, bacterial, viral, less exposure to sick people. So I think that there are huge advantages. Also, when you go home, you're in a familiar environment. And as we age, our brains can get scrambled a little easier. And so being back in a familiar environment is very helpful. You certainly would like to stay out of a nursing facility. Some people need it, but most of us really should not go to a nursing facility. So the concerns are pain. Everybody says, well, it might hurt me too much. I might not be able to handle it. I can tell you we have multimodal pain pathways, and this what that means is that we have long-acting drugs that can last 48 to 72 hours that are either injected or with blocks around your joint. And that takes the worst of the pain away. It doesn't take all the pain away, but it takes most of the pain away. And then there's ice therapy. There's anti-inflammatories that we start before surgery. There's acetaminophen. There's some non-narcotic options, and then there's also narcotic options and opioids. We try to keep you away from the opioids as much as possible. And most of my patients actually do pretty well, and very few of them actually have to take opioids. We get you up, get you moving, and that is very important. When you're at as an outpatient, you go home 2 or 3 hours after surgery. So people worry about help. Who am I going to get to help me? Well, usually a family member can stay or a friend. It's not like anybody needs to lift you. You should be able to get from the bathroom to the kitchen to the living room on your own. You shouldn't have to need someone to lift you. What is handy is someone to maybe help you with food, to help you get things, to get things out of the way. I mean, just little things. So it's good to have someone there for the first 2 or 3 days. Uh, the surgery is the same, whether we do it as outpatient or inpatient. And so we're still using the latest technology, and that latest technology is actually what's enabling you to go home now. Therapy. People say, well, I'm going to need therapy. Well, I would tell you that most of the therapy is best as an outpatient. And the reason for that is it forces you to get in a vehicle, to mobilize, to get to the therapy place. And there you usually have therapists who are used to seeing joint replacements, and you have other people who are in the same boat you're in. Remember, you're healthy, and we want you as healthy as possible when you come to surgery. So it's just perfect to do this as an outpatient. And you're not sick, you're just coming in for a tire change. We're really looking forward to starting back up with surgeries, and I think that most of you can do this as an outpatient. I encourage you to seriously look into that because I think it's better for your health. Hope to see you soon.